communication, there are two aspects. Communicate effectively to prevent error. That is with our team members, because nowadays the patients are being administered on the multidisciplinary team, in which the MD medicine person will be there, or say neurologist or nephrologist or other specialty team are there. And we have at Delhi Medical Council, we have noticed that they are coming at different times. Sometimes they are documenting in the records, sometimes they are not documenting in the records, sometimes they are not communicating with themselves. So either the patient is getting a lower dose, higher dose, or sometimes dose is missed, or sometimes important event is missed. So if you are communicating effectively with our team members, including the nurse, etc., so likelihood that the chances of error will be reduced. Then communicate effectively to prevent dissatisfaction. That is very, very important. If you are effectively communicating with the patient or the relative, this is applied to the patient or the relatives. If we are effectively communicating with the patient or the relative, likelihood that there will be less dissatisfaction. Once they are less dissatisfied, chances of litigation against the doctor will be reduced. So communication is. We have seen two scenarios. In one of the case, when the case came for hearing at the Delhi Medical Council, in the disciplinary committee, we called the complainant as well as the doctor in that disciplinary committee. When the team of that came, then because the death occurs, then the patient's younger brother who was there as a complainant, he touched the toes of the junior doctor and shouting abusively to that senior doctor, seeing that this junior doctor was doing the treatment okay, but he was communicating. But this senior doctor, my brother expired because of negligence on the part of that senior doctor. Because of that, he was not communicating. And so communication is an art. It should be two-way communication, and we should, in current scenario, we should ask the patient or give the liberty of the patient or the relative to ask question, and it should be documented also. See, communication. Then D stands for documentation. Documentation is very, very important from the point of view that ultimately the case, whether it is the State Medical Council or National Medical Commission or Consumer Court or Criminal Court, case will be decided based on the documentation, whatever the available in the records. And we have seen that in front of the Delhi Medical Council, the doctor, surgeon who has put up the notes is not able to read his own notes. Hospital is not able to identify who has put up the notes. So this is a situation, and ultimately the case will be decided based on the document. So documentation is very, very important. Documentation from the consent point of view, there should be consent. If the patient or the relatives are not giving the consent, it should be documented. What prognosis should be explained, it should be documented. E stands for empathy. If we are empathetic toward the patient or the relative, likelihood that the complaint will not be filed against the doctor. And last carry-home message is, we can reduce litigation just following four things. One is communication, another is documentation, third is communication of documentation, fourth is documentation of communication. If it is not documented, it is presumed that it has not been done, and sloppy documentation is always equated to the sloppy care. Thank you very much for the patient hearing. Thank you very much.